So finally, after a very long break, we are finally back with a video. I'm very sorry if this huge interruption in our schedule has led to any problems on your part. Probably not. You have a lot of resources on your part, and this is just a small medical channel, so probably no one cares, but I have to assume that somebody cared. Anyways, it has been probably 5 months since I uploaded my last video, and so here we are after a long 5-month break. I don't know how you guys have been, but I have been pretty good. Thanks for asking, by the way. Anyways, so we'll be dealing with pharmacology for now. Today's topic of discussion is a little, I might say, weird. I wouldn't say weird actually. I would say it's a little tacky. It's going to be a short video. You can already see it's the autonomic nervous system. By the way, this is my first video on my iPad, so I'm not really acclimatized with this thing as far as video making is concerned, so things might get a little bad, I don't know, but I'll try my best, obviously. So we are starting with the autonomic nervous system, but there is a but here. But we won't be going into the details of the autonomic nervous system pharmacology right now. Why am I starting with autonomic nervous system then, if we are not going into the actual details of the autonomic nervous system pharmacology? The reason is very simple. Reason is, no matter what systemic pharmacology branch you study, no matter what organ system you go into, there will always be a part, there will always be a section of drugs which are concerned with the autonomic nervous system supplying that particular organ or organ system. For example, if we were to be studying the respiratory pharmacology, the drugs affecting the lungs, the bronchioles, the upper respiratory tract, the drugs used for treatment of bronchial asthma, cough, COPD, etc. There also we would have had to study, or there would also we would have had to deal a little bit of the autonomic nervous system as far as the sympathetic and parasympathetic supply of the lungs are concerned. So autonomic nervous system is that area which branches out to everything. We already know autonomic nervous system, what it actually is. From our basic sciences, we know what autonomic nervous system is. It is basically that part of our nervous system, autonomous. That is, it is involuntary. It's not under our control. So it deals with all those nervous system functions, all those areas, all those organs, all those organ systems which are not under our control. It deals with all those actions which we cannot control, but which we show or which we display in response to a situation, or when the situation is tackled away then. For example, autonomic nervous system obviously has sympathetic and parasympathetic, and we'll be getting on with it. This video will be very much on the autonomic nervous system basics. Okay, so not just autonomic nervous system, but the very basics as well. Just the basics. So it's really, this has nothing to do with pharmacology as far as drugs are concerned. So if you're thinking that we are going to start autonomic nervous system, cholinergic drugs, anticholinergic drugs, adrenergic drugs, no. Right now, we are not going to go into them. Just the basics of the autonomic nervous system, the sympathetic system, the parasympathetic system, the sympathetic outflow, what their functions are, the various receptors, only those sections will be covered in this video. This will be a short video. So now, without any further ado, let's actually start with the topic of the basics of autonomic nervous system. So the very first thing is, what does the autonomic nervous system actually do for us? It does all those autonomic functions, that is all those involuntary functions. So it is actually dealing with all the functions that we cannot actually deal with, involuntary functions. Now the thing about autonomic nervous system is, it is very basic knowledge. We already know this actually. That is why it's basics that we are studying today. Autonomic nervous system, we know that it is having two branches, the sympathetic and the parasympathetic. Okay, so sympathetic and parasympathetic, these are the two branches of autonomic nervous system. So whatever autonomic nervous system, whatever these nerves they are doing, they can either be of the sympathetic category or the parasympathetic category. So it can be a sympathetic nerve fiber or a parasympathetic nerve fiber. Sympathetic nerve fiber, sympathetic system, they have some functions. Parasympathetic nervous system, under autonomic nervous system obviously, both of them, they have some functions and they actually are opposing each other. So if sympathetic system brings about a particular function, parasympathetic system would very definitely be doing the opposite of that for that particular organ. Okay, so for example, a very common example, we'll be coming to this in detail a little later when we'll talk about the actual sympathetic and parasympathetic system as far as their functions are concerned. But to be very precise, for example, sympathetic system, if this is our eye, then it causes what we say to be mydriasis, that is, it actually widens, dilates our pupil. But parasympathetic system on the other hand will bring about constriction of pupil, that is meiosis. Okay, so it will bring about the constriction of pupil, this will bring about dilation of pupil. So this is just an example and obviously everybody knows this. But let's, for the time being, get into a little more detail about how this autonomic nervous system actually works. Okay, we know that from the basic nervous physiology knowledge, we all know that for a nerve to function, for a nerve to actually, suppose this is a nerve fiber, suppose this is a nerve fiber, we know that this nerve fiber, it has these axon, this is the axon, right? And these are the dendrites or the axon terminal. So axon terminal, from here it will synapse with another nerve. We know this. This area, this is called the synapse, right? Now we also know that presynaptic, so this nerve fiber is situated in front of the synapse, or this is actually presynaptic, and this one is postsynaptic. The presynaptic nerve fiber is conducting a particular neural impulse. How will it relay that to the postsynaptic nerve fiber? Very simple. It will actually secrete something called a neurotransmitter. Okay, we know all of this is very basic stuff. So the presynaptic nerve fiber or the presynaptic neuron, it will actually secrete neurotransmitter, which will be relaying the chemical or the neural impulse to the postsynaptic neuron. Let's not get into any more details for now. What happens in the autonomic nervous system is very interesting. What is that? See very carefully. If I draw a very primitive central nervous system, we know that the central nervous system is constituted by the brain and the spinal cord, right? So let's suppose we draw that. So suppose this over here is the brain and this over here is the spinal cord. This structure is not to be confused with a sperm. This is the central nervous system, and a very embarrassing one at that. Anyways, so this is the brain and this is the spinal cord. Now we know that from the brain there are certain nerve fibers coming out. They are called the cranial nerve fibers. So let's abbreviate that for C. Okay. Then from the spinal cord we have the cervical, the thoracic, which is somewhere from over here, the thoracic, the lumbar somewhere from over here, and the sacral somewhere from over here. Okay. These nerve fibers which are coming out from the brain and the spinal cord, obviously they are going into major distant regions, organs, muscles and other structures, right? So these neurons, these nerve fibers, they will obviously synapse with other nerve fibers and will form a collection of these cell bodies which we know to be ganglion. So if I am to draw a ganglion, let's draw it with green. So suppose that okay, let's draw it with this thing. Suppose this is a ganglion, and from here this presynaptic neuron is actually synapsing with the postsynaptic or postganglionic neuron. So this is the white one is the presynaptic. So if I am to draw it again, this is the presynaptic or the preganglionic. Let's call it preganglionic. This over here, this is the postganglionic. Okay, okay. And this is the synaptic region or the ganglion actual, the yellow one is the ganglia. So the same would go for the thoracic, the lumbar and the sacral outflows, right? So let's quickly draw them. So if I am to draw it, suppose this and this. Okay. So let's continue this up to here and bring all of these to one line. And let's label these synaptic or the ganglion region. Why I am taking so much care for this drawing or diagram is the entire understanding of the sympathetic and parasympathetic nervous system and the neurotransmitters. Yeah, the very basic understanding is actually hinged upon this diagram. That's why I'm taking so much care, so that you guys understand this. Now, a very basic knowledge, I don't know if you guys know this, but basic knowledge dictates that we know this, that the sympathetic system in our body, it's actually governed by the thoracolumbar outflow, whereas the parasympathetic is governed by the craniosacral outflow, which means that the cranial and the sacral nerve fibers, they are actually part of the parasympathetic system, whereas let's go with blue, the thoracic and the lumbar nerve fibers, they are actually part of the sympathetic. Okay, so sympathetic with blue I have drawn over here, and parasympathetic with white. Now look very carefully. I have drawn this diagram in a particular way. As you can see, in the sympathetic nervous system, the preganglionic, that is this one and this one, the preganglionic nerve fibers, they are shorter than the parasympathetic preganglionic nerve fibers, which are this one and this one. Are you seeing it? Right, isn't it? So in the sympathetic nervous system, the ganglion, they are closer to the central nervous system, to the brain, whereas in the parasympathetic nervous system, they are actually further away from the central nervous system. To remember this, there is a very simple thing that you can remember. Sympathetic means to sympathize with someone. Sympathize, I don't know. Sympathize with someone, or to sympathize with someone. Yeah. So if I'm sympathetic to someone, I would want them closer to me. Isn't that true? If I'm sympathetic towards someone, I would want them closer. So in the sympathetic system, the ganglia, they are closer to the central nervous system, whereas in the parasympathetic nervous system, it's just the opposite. Now I had mentioned something, if you remember correctly, that for these post-ganglionic fibers, where are they going exactly? They are going towards the organs, the different muscles or organs. So let's draw those organs very quickly. So suppose this is an organ, another organ, and another organ. Okay, so these are all organs. Now in the ganglia region and in the nerve organ interface, the neurotransmitters are released. The neurotransmitters, there are two types of neurotransmitters. Now let's talk about the neurotransmitters very quickly. See, neurotransmitters, they are basically, let's go with green. So neurotransmitters, basically there are two major types of neurotransmitters. One is acetylcholine, very famous, everybody's heard of it, and the other is noradrenaline. A little, sorry, wrong spelling, sorry. So let's go with noradrenaline. So acetylcholine, let's abbreviate that with ACH, and noradrenaline, let's abbreviate that with NA. These are the two kinds of neurotransmitters which are majorly released in the autonomic nervous system. Now, in between the preganglionic and the postganglionic nerve fibers, there should be neurotransmitters being released. In either sympathetic or parasympathetic nervous system, whatever might be the sympathetic or parasympathetic, whatever might be the branch of autonomic nervous system that you're dealing with, in case of the synapse between the preganglionic and the postganglionic nerve fibers, the neurotransmitter is always acetylcholine. So let's go ahead and mark it over here, acetylcholine, acetylcholine, acetylcholine. and acetylcholine. So no matter whether you have the thoracolumbar outflow, which is the sympathetic, okay, let's give it blue because, oh, sorry about that. So whether it be the sympathetic system, this is the sympathetic system, or whether it be the parasympathetic system, the neurotransmitter in case of the first ganglia, or not the first, actually the ganglia in between the preganglionic and the postganglionic fibers, is always acetylcholine, but in case of the organ and nerve, that junction, so these are the organs, right? Over here also we'll have neurotransmitters being released, right? In that case, on the other hand, that is where the real distinction lies in between sympathetic and parasympathetic system. Parasympathetic system, in this case, they would actually release what we say to be acetylcholine, again acetylcholine, but sympathetic system, they would actually release, let's go with, let it stay, noradrenaline. Okay, so this is why majorly we say that the parasympathetic system is known as the cholinergic system, because it deals with acetylcholine in the nerve organ or nerve muscle interface or the nerve muscle junction, whereas the sympathetic system is known as the adrenergic system, because it deals with noradrenaline as its neurotransmitter, where in the nerve muscle or nerve organ junction, not in the ganglia. In the ganglia, it's always acetylcholine, whether it be sympathetic or parasympathetic. Okay, so whether it be a nerve junction or a nerve muscle junction, in the nerve muscle junction, acetylcholine in parasympathetic, noradrenaline in sympathetic, whereas in a nerve junction, it's always acetylcholine. But this is where the but comes. But there is an exception. There is an exception to sympathetic system being adrenergic system always. Exception. What is the exception? The exception is in what we say to be sweat glands. Why? Why exactly am I saying that the sympathetic system in sweat glands is not adrenergic? Because suppose this is a sweat gland and over here we have a sympathetic nerve fiber coming. So obviously if this is a sympathetic nerve fiber and this is the sweat gland, which is the effector organ or the effector gland, then since this is sympathetic, it should have been noradrenaline, right? But it's not noradrenaline, it's acetylcholine. Only in case of, or rather, I don't know whether it's only in case of sweat glands, but it's definitely in case of sweat glands. Sweat glands is a very important exception to the general rule of sympathetic system being the adrenergic system. Otherwise, sympathetic system and adrenergic system synonymous, because sympathetic system utilizes noradrenaline, whereas parasympathetic is cholinergic system. Okay. Now, having talked about these, let's very quickly talk about some basic functions of the sympathetic and parasympathetic nervous system. So, for remembering what the functions of the sympathetic and parasympathetic system are, let's make a table very quickly. Sympathetic and parasympathetic. I'll give you two, I wouldn't say mnemonic, I would say memory tool, memory aid kind of a thing for remembering the functions of sympathetic and parasympathetic system. You do not need to memorize sympathetic and parasympathetic functions because it's very logical as to what they do. So bear with me. See, sympathetic system means, just like I had mentioned before, that sympathetic means to sympathize with someone, to be sympathetic towards someone, which means that you're giving out your heart to someone. You're being sympathetic, right? So you are being sympathetic, you're sympathizing with someone. So you're actually giving out your heart to that person. You're trying to be a really caring person when you're being sympathetic. So why am I actually stressing on the heart? Because sympathetic system is actually activating the heart, kind of. It actually stimulates the heart. So in case of the heart, the sympathetic system would stimulate it, which means it would increase the heart rate, it would increase the force of contractility, it would decrease the conduction time. So it would be positively inotropic, positively chronotropic, gonotropic. It would actually stimulate the heart. Contraction of heart would be there in case of sympathetic system. How would you remember that? Being sympathetic to someone means that you're actually listening with your heart to that person. So sympathizing with someone, heart, so heart would be stimulated. Whereas parasympathetic would do the opposite. It would decrease it. Okay? So heart rate would go down and all of that. But a very amazing thing is, except the heart, almost every other major organ and organ system is down regulated by sympathetic system. So for example, let's say you're talking about the lungs. So let's say that you're talking about the bronchi. Okay, parasympathetic system would increase what? What does it mean to increase bronchi? It doesn't mean anything, right? It means it's actually contracting the bronchi, that is bronchoconstriction. It is decreasing bronchoconstriction, so it means bronchodilation. Okay, let's suppose bladder, the urinary bladder. Again, constriction of bladder, which means increased urine outflow, and decreased means decreased urine outflow, right? Again, let's say glands. Parasympathetic would increase your secretions, it would decrease the secretions. So other than the heart is the only one which sympathetic is kind of stimulating, constricting, contracting. For all the others, it has a relaxing effect. So decreased urine, decreased secretions. The example that I gave before, pupil, it would increase the pupillary constriction. So increased constriction, the scientific term for which is meiosis, not the MEI meiosis, but MIOSIS meiosis. Okay, whereas this would again decrease the constriction, which means mydriasis. Okay, so this is more or less the functions of sympathetic and parasympathetic system. You can remember the functions of sympathetic and parasympathetic system by another way. You can remember this by the fact that sympathetic system the sympathetic system is essentially the emergency system. What does that mean? Suppose this is you, and you suddenly find yourself in front of a very dangerous animal, right? Suppose a lion. So suppose this is a lion and you find yourself in front of a lion. So then whatever your body would need to do, your body would need to run. You would need to run as fast as possible. So in case of emergencies, whatever your body would be doing is under the influence of sympathetic system. So your heart would be racing. So your heart would be very effective. So the heart rate would go on, and it would increase. The conduction rate would actually decrease. The rate would actually increase, and the conduction time would decrease, and the force of contraction would increase, and you would have bronchodilation because your lungs would need air, more and more air. So you would have bronchodilation, decreased urine, decreased secretion. These are functions that are not that essential at that point. At a point of emergency, you wouldn't actually be caring about your urine outflow or the sweat gland secretions or the stomach acid secretions, right? So you wouldn't need them, right? So that's why they decrease under sympathetic system. You would be decreasing the constriction of your pupils so that you can see more, you can see better. So see, all the functions of sympathetic system, they are actually linked to survival under very stressful, extremely stressful and emergency situations, right? Whereas parasympathetic system is more on verge of bringing you back from that emergency state to the normal state. Okay, so this is more or less the functions of the sympathetic and parasympathetic system. Now very quickly, within 5 minutes, we will just give a brief synopsis of the different receptors of the sympathetic and parasympathetic system. So very quickly, because we won't be going into the details right now because we are not studying the actual autonomic nervous system pharmacology. Under that we will study these under detail. But this discussion, as I have already mentioned before, is purely based on the fact that autonomic nervous system, very basic understanding is needed for all the organ system pharmacology that we will be studying. So this is the first topic that I chose. Anyways, so receptors for the parasympathetic system and the sympathetic system. Now listen very carefully. Parasympathetic system receptors are of two types, more or less. The muscarinic receptors and the nicotinic receptors, right? Muscarinic receptors and nicotinic receptors. These are actually named on the basis of the fact that muscarinic receptors are those receptors which are actually stimulated by something called as muscarine, whereas nicotinic receptors are based on the fact that it's stimulated by, you guessed it, nicotine. That's why the names are muscarinic receptors and nicotinic receptors. Okay, these are the parasympathetic receptors. Under muscarinic receptors, we have three major types: M1, M2 and M3. Okay, whereas under nicotinic receptor we have more or less two major types. One is NN and the other is NM. NN is for nerve ganglia whereas NM is for nerve muscle junction. Okay, but I think they are not really called as of now. These receptors are named, I think, N1 and N2. They are not actually named NN and NM. I would have to look this up. Anyways, more important are the muscarinic receptors, because all the drugs that we will be talking about in the parasympathetic, when we will be talking about the pharmacology aspect, they will be basically dealing with the muscarinic receptors, more or less. They will be more detailed on the muscarinic receptors. So where exactly are these receptors situated? That also we will have to know, right? So we have seen that M1 is more or less situated in the brain, the central nervous system, and the stomach area. M2, very interestingly, it is situated in the heart, and M3 is situated elsewhere. That is, elsewhere, everywhere actually. What does that mean? Other than heart and stomach and the CNS, whatever you can think of, M3 is there. So we have M3 in the bladder, we have M3 in the GIT, we have M3 in the bronchi, we have M3 in the glands, pupil, everywhere. Okay? Okay. So how do you actually remember where these muscarinic receptors they are present? So for this, actually I would suggest that you take a subscription of Sketchy. Sketchy is a very good subscription service which actually provides these very detailed and cartoon pictures, and that actually helps in remembering stuff. Very good, it has helped me out a lot. But if I am to give a tip on how to understand, or rather how to remember, it's not much to understand, how to remember this, I would say that you can remember this by the fact that, for example, first you eat, then you learn by heart, and then do everything else. This is actually a rough translation of a Hindi mnemonic. Hindi is the language, if you don't know, my native language, kind of. So in Hindi it's actually a very good mnemonic, but in English if I translate it, this is what it translates to. First you eat, then you learn by heart, and then you do everything else. So eat, stomach, learn by heart means M2, stomach means M1, heart means M2, everything else means M3, right? So this is more or less a way of remembering where the muscarinic receptors are present. Now, apart from the nicotinic and muscarinic receptors in the parasympathetic system, we have the sympathetic system. Sympathetic system, again, just like parasympathetic system, has two types of receptors: alpha receptors and beta receptors. Alpha receptors, they are more or less two types: alpha 1, alpha 2. Beta receptors, on the other hand, are of three types: beta 1, beta 2, and beta 3. So where exactly are they present? Now the details of the adrenergic system, it would be much better if I actually mention this when I am actually talking about the adrenergic pharmacology, because if I mention it right now, there are a lot of tricks to remembering the functions of these receptors and where they are present. This is a lot more detailed than the muscarinic receptors, right? So I would say let's hold off on this for now. Okay, so this is more or less the sympathetic and the parasympathetic receptors and this is the cholinergic system, the adrenergic system, and this is more or less a very basic understanding of the autonomic nervous system as well. So I hope now we will be up to date, or rather now we will be on par with whatever we will be covering next. Not necessarily the autonomic nervous system, will probably be going to the respiratory pharmacology because it's an easier topic and it's a shorter topic. Okay, so with this I hope you understood everything, whatever you could. Thank you for listening and goodbye.